In the darkest hours, even the tiniest ray of hope can give the strength to fight the toughest battles. The story of Dr. Sanat is one such story of hope and triumph against all odds. Dr. Sanat is one of the brave and selfless COVID warriors who put his life on the line to save others. Right from the beginning of the pandemic to the point he tested positive, the 30-year-old young anesthetist served with great compassion and determination on the front line.
Myself, Dr. Sanat Kumar S.D. I'm an anesthetist. I was working in the Karnataka hospitals as an ICU SR. We had this second wave of COVID spike. Initially, we were totally busy with a number of patients who were coming in, all very sick. So in the middle of all this, just randomly, I just checked my heart rate and it was around 140. So that's when I got the doubt, and then I got a fever and cough. I got myself tested. It came to be positive. I started on all the supportive treatment. Till then I was not requiring any oxygen. But once I started requiring oxygen, there was some desaturation and the difficulty in breathing.
Suddenly in the early morning, he waked us up. His saturation was almost 88 and it was dropping. It was not coming up even with the increased oxygen level. We shifted him that day early morning itself to the Prakriya hospital. Then they started all the parenteral medications. He was getting better actually. After almost 7 to 8 days, he got better. He started walking with the NRBM mask, which gives 100% oxygen while wearing. We thought he is getting better and he was improving also. But suddenly on 26th midnight, we got a call from the hospital saying that he is getting desaturated. His saturation levels are coming down and it was below 60. He was not getting the oxygenation and he was deteriorating, and they intubated him. And when they repeated X-ray, it was almost 24/25. So that time on hardly 5% of his lung was left. The next step we have left with is only on ECMO.
So when he arrived in our hospital, he was already intubated. He was on 100% oxygen, but barely managing to have enough oxygen in his bloodstream to survive. So the first thing which happened on the day he arrived, within half an hour of his arrival, was he went onto a heart-lung machine, something called as an ECMO, to help him oxygenate the rest of his body. The ECMO was instituted almost within half an hour of his arrival into the hospital, and he managed to keep him on the ECMO running for almost a month. Now that period of time was a waiting game, waiting for an option of either his lung getting better or any other alternative like a lung transplant. Unfortunately, in spite of waiting for almost 2 to 3 weeks, there were no signs of Sanat's lung getting any better. So he ended up being listed on for an organ transplant for lungs if they were available in the region. Luckily for us, in another 2 weeks' time, a pair of lungs was available as a cadaveric donation for Sanat, and he ended up having a lung transplant. The period while he was waiting for the lung transplant to happen was on the ECMO, which is a very specialized equipment which keeps people alive by exchanging their carbon dioxide and oxygens in their bloodstream, and we are able to sustain them for long periods of time. Sanat's not been the longest on the ECMO, but he's been one of the most successful ones on the ECMO for us, and we've had a significant amount of experience managing these COVID patients who have gone on to ECMOs and who've had other challenges along with it. The story of Sanat is a hope for most of the COVID patients that there is some light at the end of the tunnel, and things like an ECMO or a lung transplant can be an alternative, but mainly suited for somebody who's young, who's fit, and who is able to go through the rigors of having such a procedure done.
Due to the extent of lung damage and life-threatening complexities of this case, the doctors at Aster CMI advised lung transplant as the last resort to save Dr. Sanath's life. With his indomitable survival spirit, Dr. Sanath became Karnataka's first ever post-COVID patient to successfully receive a double lung transplant.
A double lung transplant is a grueling surgery, and it may be the only solution for patients who experience life-threatening combinations of lung damage caused by the COVID-19 virus and the patient's exaggerated immune response to it. This unfortunate coupling and the body's failure to properly repair this injury can be devastating at times. Eventually, as the body heals itself, in the self-repair phase, the deposition of yellow fibrotic scar tissue creates a liver-like densification that makes the lung completely solid. This process of misdirected and inappropriate self-repair irreversibly destroys the tiny alveolar air sacs through which gas exchange actually happens. Patients really only survive to that fibrotic stage if they are intubated and at times transition to ECMO support when ventilation is found to be inadequate to support gas exchange. This harmful scarring can usually occur within the first few weeks of viral pneumonia. Unfortunately, some of these patients suffer extensive and permanent damage to their lungs, making a double lung transplant the only choice of definitive therapy. What makes this surgery uniquely complex is the subset of patients that are forced to accept this option. Most of them we know are intubated, in the ICU, deconditioned, nutritionally inadequate, and suffer from not just airway but also bloodstream infections because of their prolonged hospitalization and multiple rounds of immune suppression to control the cytokine storm created by COVID. The ones on ECMO life support have additional challenges which are related largely to the long duration of ECMO support, which are also related in ways to the activation of the immune system and various coagulation disorders, some of them natural, some of them caused by the COVID virus, and some of them because of the medications that we utilize and ECMO. Treating these critically ill patients successfully with a double lung transplant personifies and animates the overall abilities of a high-quality transplant program. I truly believe lung transplantation is very special because it is the only transplanted organ that faces the dual challenge of both the airway and the recipient's bloodstream, making its surgery, its recovery, aftercare, and long-term stability a team-based, vigorous, evidence-based, and highly regulated process.
Now, lung transplant is an option that comes as a turnaround for these patients who hit the dead end. And increasingly, we are seeing that patients with chronic lung diseases who have hit the dead end and who have no other option but to replace their old lungs with a new pair of lungs tend to do better with the newer advances in the field of medicine. And also, we are seeing that they have a reasonable quality of life.
I would appreciate and the amount of effort what the family has also taken in terms of understanding the process. At the same time, help us to go to the next level where we were able to convince them whether should we go for a lung transplant, where that would be the option when the native lungs were not in a position to recover.
We took a little while in getting Sanath better. He's been with us for almost 3.5 months and he was recently discharged home. And it was possible, not only by us doctors, it was possible by the excellent support staff that we have, especially physiotherapy, our nurses, our dietitians. Obviously, all of this could not be possible without the family support as well. So after 3.5 months of hard work, helped by Sanath, Dr. Sanath, obviously because he was an intensivist and an anesthetist as well, so he knows exactly what to do. We finally sent him home and I wish him all the best at home.